So everything we do as physios or kins, we identify impairments and then we structure our treatment plans based on the impairments that we've identified. In terms of concussion rehab, it's no different. We just need to look in a different place, in a slightly different way for the impairments that we're interested in. My belief is that if you do a good assessment and if you catch everything you need to see when you're going through your assessment, you'll have a lot more success in identifying the impairments and then developing your treatment plan. So that's the focus of this. I want to look for impairments in this population, people with concussions, and then help you structure your treatment that way. So a little bit of background. Concussion is at the mild end of the spectrum of traumatic brain injury. Mild because there is no bleed, there is no contusion, there's no structural imaging problem with this injury. Mild is sometimes a bit of a misnomer because it doesn't, like the symptoms are not mild, the impact on people's lives is not mild, but the injury is less severe than some other brain injuries. The effects can be very debilitating for patients. So this is the standard definition that you see. It was updated this year. Have any of you guys seen or heard or read the consensus statement on concussion that was recent? Okay. So this, I'm not going to be repeating things then. This is the definition of concussion. People do not need to get hit in the head. It can be a blow to the face or anywhere else on the body with force transmitted to the head. And it results in an impairment of function, but not structure. So it changes the way that things are working, but there's nothing that we see structurally associated with concussion. A couple sort of updatey things. We no longer grade concussions. There used to be this grade 1, grade 2, grade 3, and then there was, they simplified it to simple or complex. All of those distinctions are made based on how long it took, or were made based on how long it took the injury to recover, which is really not helpful from a diagnostic point of view. So now it's either you have a concussion or you don't have a concussion. The symptoms of concussion can be divided into these 6 clinical domains. So we have symptoms, which can be somatic, cognitive, or emotional, physical signs, there can be balance impairment, there can be behavioral changes, there can be cognitive impairment or sleep-wake disturbances. From our point of view, we're more focused on this end of things, the symptoms, physical signs, balance impairment. But this is a really good slide to sort of visualize when we talk about a team approach to concussion rehab or persistent symptom rehab. There are generally several people involved because the signs and symptoms span such a wide range of domains. So we no longer grade concussions, but we do need to distinguish between acute injuries and those where symptoms are persistent because the way that we manage them is different. An acute concussion is one where symptoms last days or weeks. Depending on the age of the patient, we say anywhere from 2 to 4 weeks is sort of the normal recovery time. When symptoms last longer, you will hear the condition referred to as post-concussion syndrome or disorder. The research community is sort of advocating moving toward persistent symptoms as the term we use because we're trying to get away from labeling people with a syndrome or a disorder. And it's a distinction that you should make when you first start to see somebody, but it's also a distinction that will evolve over time because if they are acute and they're improving, but then things stop improving, they may shift more toward a post-concussion syndrome diagnosis. Also, we'll come back to this, but acute concussions can be fairly self-limiting. Your role may just be monitoring and educating, and people get better on their own, and that's okay. That's really good. So there have been several different definitions of persistent symptoms or post-concussion syndrome. The World Health Organization was defining it as symptoms longer than 3 weeks. The DSM-4 was symptoms longer than 3 months. The Ontario Neurotrauma Foundation came out with a set of guidelines in 2013, which are still really valuable. Their definition was symptoms persisting beyond the natural recovery period. Clinically, that is not a super helpful definition. So in April, when the Concussion in Sport group published their consensus statement, they defined failure of normal clinical recovery in adults as taking longer than 10 to 14 days, and in kids, longer than 4 weeks.